So first of all, what's the trial aiming to find out, and is it on track? Well, let's go back to the beginning and just think a little bit about heart and circulatory disease, because that's really what the focus of this trial is, trying to see if we can come up with a treatment or demonstrate a treatment that helps us in the prevention of heart and circulatory disease. Now, the diagram on the left shows us what a normal artery would look like. The tubes that carry the blood around your body are simply that. They're tubes, and a nice normal artery is a lovely clear tube that if you did a cross section of it, cut it through the middle, you would see this nice clear circle with nothing in the way of the blood that's flowing down the middle. Unfortunately, many of our arteries don't look like that, and they can start to get narrowed with this sort of debris, this rubbish that gets stuck into the lining of the artery, so that then if you did a cross section of that and cut it through the middle, you would see a really narrowed space with not much room for the blood to flow through, and this jagged irregular lump that is mostly made up of fatty deposits, typically from cholesterol. And so that causes narrowing of the arteries, which can cause symptoms like angina. And even worse, on top of that, it's possible to get a blood clot that then sticks onto this rough surface, which can completely block the artery. And that's what causes a heart attack or a stroke. So you can see that this narrowing of the arteries is a potentially really big problem. Now, saying that, actually things are looking really good as far as heart and circulatory diseases in the UK. This is a graph that shows us the rates, the death rates from heart and circulatory diseases over the last 50 years in the UK. The top sort of deeper red line is the rates in men, the bottom pinky line is the rates in women, and through the middle is the red line that shows everybody all together. And it's very obvious that over the last half a century, the death rates from heart disease and circulatory diseases have fallen considerably, really because we've understood so much more about preventing these diseases and providing treatments that really help to reduce the chance of dying from these diseases. However, I'm afraid the story isn't all good, because when we look at overall deaths, both in men on the left-hand side of the chart and in the women on the right-hand side, I'm sorry to say that cardiovascular disease, so diseases of the arteries, are still one of the major causes of deaths, even though the rate of these deaths is reduced and people are living for much longer than they used to 50 years ago. Actually, in men, about 40% of deaths are caused by cardiovascular disease. In women, it's nearly half. And so it is still a big problem. Now, we know that cholesterol is really, really important in relation to heart and circulatory disease. And I've already shown you the picture of the tubes with those cholesterol deposits in them. And we've now got a lot of really good drugs that can help us with that. Most of you, I expect, are already on a drug called a statin, which is a really effective way of reducing bad cholesterol. And we know that taking a statin reduces the risk of heart and circulatory problems such as heart attacks and strokes. And we also know that if you take a stronger statin, that reduces your risk even further. And so the lower your cholesterol goes, the better it is in terms of protecting your heart. And so we've also got some other tablets, other types of tablets alongside statins that we do use in many people to reduce bad cholesterol even more where people are still at high risk, and to reduce that chance of a heart attack or stroke as much as we possibly can. But in spite of that, still, unfortunately, people are suffering heart attacks, strokes, and other circulatory problems. And so what we want to find out in this trial is whether this new drug inclisiran, which is a new way of lowering that bad cholesterol, might be a useful extra treatment to add on top of what we've already got to reduce the chance of those problems even further. Now, inclisiran is quite an unusual drug, and David will tell you more about it. It's given by an injection under the skin every 6 months. You all know that. You've been receiving those injections. And it is really impressive because it reduces the bad cholesterol, the LDL cholesterol, by about half. And from what we've seen from early studies, everything looks very promising for this drug. There's no suggestion of any safety problems, and it seems to be very well tolerated. And that's just a little picture down the bottom there of the syringe that it comes in, and you'll all have seen that from your study clinics. So what we're trying to find out in the Orion 4 trial is whether taking inclisiran for about 5 years reduces heart attacks, strokes, and urgent procedures to unblock or bypass a coronary artery in people who already have heart and circulatory conditions. Because we know that once you've already had a heart attack or a stroke or arterial problems in the legs, unfortunately, you're at a higher chance of having more of those problems. So we really want to try to reduce those as much as we can. How are we going about it in the study? Well, you're all familiar with what happened at the beginning. So we invited people who were potentially at high risk of these problems. So we had women aged over 55, men a slightly lower age group, aged at least 40 years. That's because men become at risk of heart disease at a slightly younger age than women do. And everybody who joined the study had previously had a heart attack or stroke, or a procedure to open up the arteries in the legs, or a repair to what's called an aortic aneurysm, a sort of ballooning of the main blood vessel from the heart. And you attended the first visit, which we called a screening visit, where the nurse at your study clinic asked you some questions about your health, told you about the study, gave you some information to read, did a little finger prick blood test. And if everything looked like you might be suitable and you were interested in joining the study, then you went into what we call a run-in phase, where we then got in touch with your doctor about it to check out that they were happy. And then you came back a few weeks later for a randomization visit. And at that point, we effectively tossed a coin. Our computers tossed a coin and allocated half of you to one group and half of you to the other group. And in those groups, one half get the real drug, the inclisiran, and the other half get a dummy version of it that we call a placebo. It looks exactly like inclisiran, but it just doesn't have the active ingredient in it. We don't know who gets which one. Our computer systems know, but on a day-to-day basis, David and I don't know. The nurses who see you in the study clinics don't know. Your own doctors don't know. Anybody that you speak to on the phone here in Oxford, they don't know on a day-to-day basis who is receiving which drug. And that's really important, because that is the best way of us then finding out over the course of the study what the actual effects of inclisiran are compared to the dummy version, the dummy injection, and giving us a really reliable answer as to whether it's a good idea to use this drug a lot more widely in the NHS. This graph shows us how we went about recruiting people into the trial. The trial started way back at the end of 2018. Just a few people were recruited during 2018, and then we sort of really got going in 2019, and things were going very, very well, with new study clinics opening up across the UK. And I'm sure many of you have been in the study from that early time. And had everything carried on as we expected, we thought we'd have completed the recruitment phase probably towards the later part of 2020. But of course, the COVID pandemic got in our way early on in 2020, and we had to stop the recruitment for the trial because the NHS hospitals that were helping us with it were very busy looking after patients with COVID. And so we had to temporarily halt recruitment, and we were able to stay in touch with the people who were already in the study. Some of you may have had telephone calls during that phase. Some of you may even have had injections in your own home. We had a system where we were able to, in some places, arrange for a nurse to come out to people's homes during the pandemic when it wasn't possible to have the doses at the clinic. Thankfully, though, we managed to keep going and got back on our feet, and in 2022 we could start recruitment again, and we got to our final total towards the end of 2023 with a really very impressive 13,190 people in the UK involved in this study alone, which makes it one of the biggest cardiovascular trials in the UK. It's probably the first point at which I need to thank you all for taking part in the study, because obviously without you we aren't able to do this important research. And we really were delighted at the responses that we got, and your commitment to helping us with this really important piece of medical research. Alongside the UK population in the trial, we've also got nearly 3,000 people in the USA who are also participating in the trial. And similarly, they didn't have quite the same sort of shutdown of their health system during the COVID pandemic. So they sort of slowly and steadily recruited their numbers over that full duration of time. Here are a map of where all our study sites are in the UK. You can see the length and breadth of the country, up into Scotland, down to the very far southwest. And some of our study centres really doing an excellent job of getting large numbers of people in to the trial, over 200 patients at a good number of centres, even 300 at one of our centres. So a huge thank you to the staff at the study sites, but to you all for offering to help and volunteering to be part of this important study. Just for completeness, here's a map of the sites in the USA, and you can see again it goes the length and breadth of the country with sites all over the US helping us out with this important study. So there are participants like yourselves who attend study clinics in all those different states, helping us in exactly the same way as you are. And then perhaps the most important question, I'm sure, is on everybody's lips: how long will the study go on for? Well, when we first started the trial, we knew that we were going to need to go on for an average of about 5 years of follow-up. And we also knew that we needed to have at least 1,700 of what we call study outcomes to occur. Now, what's a study outcome? That's the thing that actually determines the results of the study. What we really are looking at is how many people during the course of the study have a heart attack or a stroke, or sadly die from vascular disease, or have a procedure to open up the arteries around the heart. Because those are the things that we hope inclisiran will reduce. And at the end of the study, when we break the code, we look at how many of those outcomes happened in the people who were on the real inclisiran, and how many happened in the people who were on the dummy version. And we compare those numbers, doing some careful statistics to see if inclisiran has made a difference to those numbers. The problem is we have to have enough of those numbers to know reliably that we're definitely looking at a real difference, rather than just something that can happen by chance. And I always think at this stage, it's a bit like tossing a coin. If you toss a coin 5 times and you get 4 heads and 1 tails, it's a bit unusual, but it's not amazing. You wouldn't think your coin was necessarily bent in any way. But if you tossed your coin 5,000 times and you got 4,000 heads and 1,000 tails, you might start to think that there's something a bit funny about your coin. It seems like that's more than just the play of chance. And so that's why we have to have in the study enough of these outcomes to know that we've definitely got a real reliable answer. And to do that, we have to go on for long enough to be able to have enough people, unfortunately, experiencing these outcomes. And then we had the problem that COVID-19 got in the way. So we knew that we were going to need to carry on for an average of at least 5 years. But we expected originally that everybody would join the study sort of all in one batch. But as you saw on the graph, actually, there were sort of 2 separate batches. And so that meant that it has prolonged things a little bit. And so the people who joined the study early are going to end up having been in for a little bit longer than 5 years, whereas the people who joined the study later, it's a bit shorter than 5 years. And so overall, what that means is that we're going to need to carry on until 2026. And we anticipate that your final study visits will happen from around about Easter to the early part of the autumn next year. So we're kind of on the home straight. We've probably got about a year or so to go. You've probably got 3 appointments or so. It depends. Some people might have 4 before you're finished with the study. And we really, really hope that most people will be able to stay with us for that very last bit, because this is almost the most important part of the study. The more people that can continue with us right to the very end, the more strength the trial has in terms of helping the medical profession decide whether inclisiran is a good drug to use or not. I know it feels like it's been a very long time for some of you, and so we are so grateful for you sticking with us, and I do hope that most people will be able to keep going. Ideally, we want people to carry on having their injections throughout all of that time, wherever possible. But even if there's a reason why you can't have the injection, then actually still coming to the clinic visits and having the blood tests taken is really, really valuable for the study. And if it's very, very difficult to get to the clinic, then one possibility is to at least come for the final visit in that final period. But we really hope that most people will be able to just keep on coming for those last few visits. So I'll wrap up with a summary. I hope I've shown you a little bit about why lowering cholesterol with statins protects against heart and circulatory diseases. And we also know that inclisiran is really impressive at reducing the bad cholesterol by about a half. What we need to know now is whether by taking inclisiran for 5 years in the study, possibly longer in real life, protects against heart attacks and strokes and other conditions, and does it safely. So we want to be certain that there aren't any side effects from it. We have completed recruitment despite COVID-19, and that is a real, a very, very impressive achievement from everybody, because many trials had to stop during the pandemic. So again, a thank you to you for sticking with us throughout those difficult times. But because things took longer, we've got to carry on a little bit longer, and we will be running until 2026, at which point the trial will finish and we'll be able to analyse all the data, and then we will be able to let you know what the results of the trial are, which will help you and your doctors decide what you should do from now on.